Hello, welcome to another episode of Cardiology Update. My name is Chadi Alraies from Detroit Medical Center in Detroit, Michigan, United States. This time I'm coming to you with an update on a recently published article related to something new, which is the burden of cardiovascular disease in the population. In this new article, the authors it's a collaboration between three main organizations, which is the Journal of American College of Cardiology, NHLBI, as well as the what's called the IHME, which is a collaborative effort to generate the report called Almanac. This report is studying the burden of cardiovascular disease over a course of many years, starting from 1990 all the way to 2022. The focus of this report is to evaluate the burden of cardiovascular disease, as well as study other parameters and factors implementing the increase or decrease of cardiovascular disease over the course of this time period. With that introduction, I would like to dive in more into the report and go over some numbers with you. In this report, there is a few highlights I would like to bring to you as summarized by our colleagues from Cardiology Update. Number one, there is an increased global burden of cardiovascular disease mortality globally. And this is alarming as we are working more actively on finding new therapies for cardiovascular diseases. The mortality continues to go up, not because we are not doing the therapy right, not because there's a prevention that is also missing. Second part is there's a global burden increase in the global burden of cardiometabolic syndrome that include increase in diabetes, obesity, high cholesterol, as well as a pandemic of smoking. Moving to the third point, which is there is a global variation in the impact of cardiovascular mortality. And this is very easy to interpret because there is different countries and different nations and states have different resources in terms of evaluating the burden of the disease, preventing the disease from happening, and eventually treating that disease. The fourth point is the impact of the global impact of cardiovascular mortality in low and intermediate income communities. And this is very alarming. As this class of population is growing in numbers, it has been shown it has the highest mortality as well as cardiovascular disease burden in the low and intermediate income communities. This is why there's prevention, a lot of efforts has been put together or has been called for in putting new initiative for prevention in this population. And the last one is the impact of air pollution on the cardiovascular burden, with an increase of the air pollution and impact that on cardiovascular disease by 65% since 1990 compared to 2022. So based on this report, we know that there is an increased burden of the cardiometabolic syndrome. There's increase in mortality also due to cardiovascular diseases. And there is variation globally in terms of the impact of the cardiovascular disease in different countries. And most importantly, which is at the community level, there's increased burden of disease in low and intermediate income communities to have more cardiovascular diseases and metabolic syndromes. So basically, this is a report where summarizes the fact that we have been developing or has been developed over a course of more than 20 years, but more importantly now how to interpret this result and how to work and create action plan to prevent these from happening going forward. There is a lot of initiative, as mentioned earlier, on the prevention in terms of management of lipids, management of obesity, as well as diabetes. But we cannot forget the fact that education is very important. And as with the population growing in numbers, we have to focus and find resources to educate this population as well. I really find that this article is very enjoying to read, and also from an epidemiological standpoint, it's alarming as well. So as a treating cardiologist, most of the time we are the front line to treating patients with cardiovascular diseases, but now we have to focus on prevention more. We have to focus on giving resources to primary care, educate the community, going workshop in communities, in public libraries and other places for patients to learn about the impact of cardiovascular disease, the impact of environmental factors on the cardiovascular disease, as well as giving them resources and access to healthcare to prevent this from happening. I hope you enjoyed this episode of Cardiology Update. My name is Chadi Alraies from Detroit Medical Center. Watch these episodes on all YouTube channel, as well as LinkedIn, Facebook, and Instagram, coming to you from Cardiology Update. Thank you for watching.